My name is Shimizu from Kagawa University. At Kagawa University, I am the Deputy Director of the Gender Equality Promotion Office and involved in education and research in the field of chronic phase adulting in the Faculty of Medicine. Today, I would like to talk about our support for school health in Cambodia. Our support began in 2016 when we went as a JICA Corps member to conduct a preliminary field survey for the implementation of a JICA grassroots project. This is showing the whole project. The top part of the slide, we are showing the organizations and institutions, and on the left-hand side, you'll see the timeline. The grassroots project from 2017 was implemented under a bilateral contract between Kagawa University, Kagawa Prefecture, JICA, and the Ministry of Education, Youth, and Sports of Cambodia, hereafter referred as the Ministry of Education. In 2016, Cambodia had already developed a rough school health policy modeled after Japan's, and model schools have been opened only in Phnom Penh City. However, Cambodia's domestic infrastructure is not well developed, and the economic disparity between Phnom Penh and the provinces is very large, such as the economic disparity between the dollar society local currency, real society. The grassroots project was to transfer technology for Japanese-style school in school infirmary system to all 32 elementary schools in Kandastan district, which is an hour drive from Phnom Penh. The photo on the right shows the ministers' meeting in February 2020 during the closing ceremony, where the local health rooms, toilets, and washing stations, and the copyrights to the school health text model we developed were transferred free of charge. Subsequently, the EduPort Nippon supported project and the school health checkup model project were conducted as part of a project to promote the international deployment of medical technology commissioned by the Ministry of Health, Labor, and Welfare and achieve the goals of the JICA project. As a side result, an academic exchange agreement was signed with the National University of Health Sciences, the oldest medical school in Cambodia, and student exchanges were initiated. Cambodia has renewed its National School Health Plan in 2019, and this research project has begun with the goal of advancing grassroots projects. Following is an overview of the results of the JICA project. The framework for the support is shown in the upper left-hand corner. To be implemented as a bilateral project, local teachers and administrators from the local region to come to Japan for training and to serve as facilitators. Japanese experts should travel to the site to conduct local seminars and follow up with local staff. Our people were seconded to the government, and we had a close exchange of information. Kagawa University has dispatched its vice president 4 times to provide a high level of local judgment, among other things. We were able to reform a local which the Cambodian government were struggling, and were able to reflect the reform in policy through 3 meetings with the minister and a visit to Japan by the Director General. There are 3 main results. From bottom left, Cambodia's first school health textbooks were produced in English, Khmer for teachers and children. For this text, a joint working session between the Ministry of Health and Ministry of Education was held for the first time in Cambodia. Relevant items were extracted from a 6th grade science subject textbook and referred to a Japanese school health textbook to ensure the validity of this text. The second result is the school health room system in the upper right corner. Teachers who have visited Japan created a school health room and health room area in their own schools, and Kagawa University provided guidance on first aid kits, how to manage them, and the role of the health teacher. At the same time in Cambodia, training for school health counselors began at a 4-year university, support of the Tokyo Gakugei University, and is expected to produce such counselors by 2023. We hope that the schools in which we intervened will become training facilities. The third result is a model of a toilets. These projects were promoted by exchanging information with JICA. The third result is a model of toilets and hand washing station, originally designed by Kagawa University. We constructed a sturdy underground container-type toilet that cost 3 times the local price. The lower right is a photo of the children at a school toilet. Here, EduPort Nippon supported project did the following. Sorry. Here, EduPort Nippon supported project did the following. Since the promotion of school health requires collaboration between the Ministry of Health and the Ministry of Education, therefore in 2018, we invited the respective deputy directors of the Ministry of Health and the Ministry of Education to receive training on school health. And you will see upper left is training at the school attached to the Faculty of Education, Faculty of Medicine, and below are the results of evaluation. Since Japan health centers do not exist in Japan, it was regarded highly. They also indicated they learned about this curriculum in teacher training schools and the need for school health committees. On the second year, 2019, a model project for school dental and internal medicine checkups by physicians who traveled to Cambodia. With the cooperation of the local minister and the school president, this medical checkup was conducted with the participation of Ministry of Health, the Ministry of Education, the Kandal Provincial Medical and Education Department, and the faculty of Medicine, Dentistry, and Nursing at the National University of Health Sciences. The upper right is a dental checkup, and the graph shows the results. This study was conducted in the capital city and Kandastan district, respectively, and found the correct instructions of tooth brushing for children was necessary in both areas. The internal medicine checkups revealed the already known problems of obesity in urban children and thinness in rural children, a high percentage of abnormal urine tests, and the presence of neurological diseases. This is an institutional relationships chart of the research projects that are being conducted in response to the supported project. Kagawa University will conduct this program in collaboration with the Kagawa Prefecture and in collaboration with the Cambodian Ministry of Education and the National University of Health Science. In the Cambodian government, it is to develop a centralized management system for children's health examination data. In the University of Health Sciences, it is develop a field of education and research that will lead the field of school health in the future. In the first year, nursing faculty members of Kagawa University first created online teaching materials and conducted online training. The theme was the introduction of Kagawa University support for the National School Health Plan in Cambodia. The following topics were introduced, namely examination items that can detect obesity and emaciation, lifestyle habits of children at home, preschool health examination, and immunization. The contents of this video has also been prepared as a text. 80 copies of the text was distributed to the government as a guide for collecting school health examination data. A total of 190 copies were sent to the National University of Health Sciences for teachers to cooperate in the collection of health examination data and for school health classes. As for the school health checkup data system in Cambodia, since the number of children is about 2.6 million, the Excel file is used as a database on the cloud, and the is prepared under the guidance of faculty members of the Faculty of Creative Engineering of Kagawa University. The system image is shown in the slide. On the right side, the government designates the elementary schools where data is collected and conducts the health checkups. The data can then be entered and aggregated by district, province, or state, and the government can download and manage the data to create international indicators. The main measurement and output data are shown in this slide. The activities I just mentioned are shown on the left, and we will promote the National Plan for School Health in Cambodia shown on the right. In Chapter 5 of this policy and Section 5 on this plan, Kagawa University model is made use of. It says we support the health, well-being, and behavior change of children and teachers to improve the learning environment in all schools. The blue part shows the support of Kagawa University, which includes sorting and managing garbage, building toilets, cleaning and keeping the school clean, collaborating with emergency services, and at the bottom, securing a multi-purpose room for consultations at the school, which is the Japanese-style health room we have created. Last is about the horizontal and interactive learning in the new normal that we have learned in this research project. I think the lessons learned with Cambodia is to have a relationship in which we can openly exchange opinions together as equals. This can be described as being involved as a friend or a team that shares the objectives of the project rather than a relationship as a developed country and a developing country. What has made our project at Kagawa University successful is the support of Secretary Kim Setani, one of the 21 female leaders introduced by the Cambodian government, who holds the position of Deputy Minister of Education. In 2016, when I first met her, she was 39 years old. In 1979, after the Civil War, when she was born, there were no birth records because of the government policy at that time. The 4 government directors who came to Japan with her same birthday December 1st, 1979, the date of independence. Because of these circumstances, their unity was extraordinary. One of the bureaucrats who worked with me to promote school health told me Cambodia is behind in many ways, but the status of women is better than in Japan. The fact that these women expressed their superiority in this matter is a sign of their membership in the activity together. Therefore, although here I'm in front of many men, it was also an advantage for me to be a Japanese woman. Also in Cambodia, even in official applications to the country, officials at the counter demanded money under the table, and even the issuance of an airport visa did so. And moreover, those of us operating in rural areas could see that we would have a hard time with this money under the table demands. However, Secretary Kim Satani even instructed the provinces and counties not to take any under the table money from our projects, and with the minister's approval to second my people within the government. We had a close exchange of information. In addition, government officials asked us to make it mandatory for Japanese project participants to learn about the genocide in Cambodia. They're trying to have a relationship with us, not hiding a negative legacy. If we were to operate for a long time, it was necessary to know the context of the country in which the people who tipped off and those who were tipped off live together. Also, when we started the project in Cambodia, citizens would put their hands together and say, JK to Japanese supporters. Cambodia is the only country I know of that has the Japanese flag on its national banknotes, and this is an achievement of JICA itself. Since we were in fact in a JICA project, we identified ourselves as JICA to local drivers and citizens alike. This was very useful for safety. In Cambodia, as in other developing countries, there is multinational support, including the former sovereign France, the United States, China, and Germany, which provides sanitation assistance throughout Southeast Asia. Collaboration with such countries, coordination with other Japanese assistants, and deep collaboration with local JICA offices are of utmost importance. Next, I will discuss access to Japanese education. Cambodia is 6 hours away by direct flight from Narita Airport, and many Japanese have settled throughout the Malay Peninsula. A Cambodian citizen told me that one country constructs hotels, supermarkets, and banks and emigrates 1,000 of its people, while Japan teaches them technology and wisdom and does not deprive us of our livelihood. Such citizens have their children learn Japanese as a third language and help Japanese people in their work. One of the Cambodian nursing students speaks good Japanese. When we asked why she's studying the language, she said, "Because I want to study in Japan." However, there are restrictions on total hours of study and other requirements for admission to graduate schools at Japanese national universities, and we also believe that special measures should be taken for countries that are not playing field. We, from the university, thought that the export would not only benefit us directly, but also help to foster a supportive mindset among Japanese researchers, improve our professionalism, and foster an autonomous organizational culture. In addition, when the Secretary of Cambodia visited Japan, the school affiliated with the Faculty of Education had a lunch experience with students of different grades in each group. The Secretary stated that he would spend his life to make school lunches a reality in Cambodia, and their goal was in Japan. In addition, a Cambodian who saw compressed plastic at a waste recycling center stated that this was coming to Cambodia, and it can be said that our lives are interdependent with those of developing countries. Our relationship with the Cambodian government was established by a Cambodian student who studied at a university, obtained a doctorate, and is now a high-ranking government official in Cambodia. Khmer interpreters are those who studied Japanese at Kampong's Friendship Academy, where they were taken into Japanese protection during the Pol Pot era and who studied in Japan. We believe that carefully promoting international students become bridges and connections will contribute to society through education. We conclude our presentation of Kagawa University with hopes that EduPort Japan will make progress. Thank you very much for your kind attention.